to talk to you about how to take care of your incision postpartum, post a cesarean birth. So I have my belly here. I drew a Sharpie, obviously this is an incision, just to show what the incision looks like. You want to help take care of this incision, just like incisions when we get orthopedic injuries, you get scar tissue. So we want to make sure that that scar tissue, as much as we can turn from scar tissue back to muscle tissue and skin tissue. Scar tissue is disorganized and it's not strong. Muscle and skin and fascia are strong. The difference between other injuries when you get scar tissue in the pelvic or abdominal region, the scar tissue can kind of start to grow and it makes little spider webs where things that used to slide independently now get stuck. And you can get spider webs from the scar through the muscle, the skin, and the uterus. It can go down to the bladder, which is very common because the bladder sits right below the uterus. It can also go all the way back to your back. So sometimes people have back pain and it's actually just adhesions in this pelvic region from scar tissue. I've had patients that had scar tissue build up 6 years post cesarean and ended up in the hospital because some scar tissue wound around their small bowel. So this is a very important thing to do post cesarean birth. So what you're going to do, first you're going to ice 2 to 3 times a day for about 15 minutes. You want to put a little small towel between you and your belly so that it doesn't burn the tissue. From 0 to 6 weeks postpartum, you want to work the scar tissue about 2 to 3 inches away from the scar. And you're going to do just little tiny circles. So you're going to dig your fingers in and do little circles around the scar. And what we're working on right now is those little spider webs that are trying to grow out from the scar. And we're trying to make sure that those don't adhere to your small bowel, your colon, which is over here. And you can get right up onto pubic bone. Here, small circles, small circles, small circles, for about 10 minutes. It shouldn't hurt, it shouldn't be excruciating, it might be slightly uncomfortable. At 6 weeks, the reason why you don't want to do it before 6 weeks is because we want that scar tissue to adhere, we want that stitching to adhere with the muscle and the uterus. At 6 weeks, when this scar is totally healed, you can get onto the scar and you want to mobilize by doing pinches, and mobilizing it so that the skin moves free from the muscle, moves free from the uterus, and moves free from the bladder. And it is recommended that you have a pelvic core therapist get in there and really mobilize the scar at 6 weeks postpartum. If you're overwhelmed with baby, at some point in your postpartum period, you should have someone come and mobilize your scar.